This video will outline the technique for the FAST procedure used to treat recalcitrant lateral and even medial epicondylitis. This middle-aged female is a bus operator. There was minor trauma in the last few months with pain and tenderness over the lateral epicondyle. She failed a brief course of conservative treatment, but now due to the FAST procedure, we can offer a minimally invasive and minimally painful procedure under local anesthesia to resolve the problem. Here we see the surgeon who does not need to be fully draped. We drape the area very locally and infiltrate a small field block using approximately 3 cc's of local anesthesia directly over the epicondyle area and the origin of the extensors. We now do a more focal, precise injection of local anesthesia with ultrasound control as seen here. This way we're placing the lidocaine strictly in the area of the course of the ablator probe, which will be used momentarily. We now make a small stab wound with an 11 blade that is part of the kit for the FAST procedure. This is all enclosed in one easily presented package. Here's a handpiece which delivers high energy ultrasound that will serve to ablate and with the handpiece also suction away that tissue. Here we have the correct trajectory of the probe as it can be seen with ultrasound direction. We will basically ablate the entire origin of the extensor with focus on the area of the extensor carpi radialis brevis. We can march along the epicondyle all the way up to that small prominent area, which is essentially a bone spur on the epicondyle itself. Here we see the setup in the room with the device to my right, and then the diagnostic ultrasound equipment directly in front of me for good visualization. This should be done in a slightly dark OR room or even a procedure room in the office. In our case, we use the operating room so the patient has some light sedation for anxiety. We only close the wound with steri strips, which are also enclosed in the pack, as is the sterile clear op site. We apply a 4x4 over that area only to avoid any direct impact from the patient, and for that reason we use an ACE bandage, encouraging immediate use of the hand as seen here. Postoperatively, there is no wound essentially. 6 days after the surgery, we will hear a testimonial from a patient. Okay, so when did we do your surgery? How long ago?
Thursday, almost a week.
Almost a week, okay. So you can straighten it completely and you can bend it? Okay. And how is the pain compared to before surgery? It was 6 days ago?
It's much better. It's not as tense.
As intense. Okay, great. Well, you're not going to need much rehab, if any, but it's a good sign that you're already better. Fantastic. We will now hear from a second patient who also had a surgery a week prior, where he goes into a bit more description of the relief.
Right now, that movement doesn't bother me. I've got free movement back. It's a little tender, but you can tell it's a lot better.
I see. So not much pain after the surgery itself.
The day of the surgery, had a little soreness. After that, it pretty much went away, and it's been pretty good.
All right, terrific. As we can see, this is a relatively simple procedure that gives excellent pain relief and resolves a frustrating problem for the clinician and the patient. This is a game changer in the world of orthopedics, as many colleagues have said.